994943 or email at info@qabayanfm.com. Qabayan Radio 94.3 FM, bringing your business to the Filipino and international communities.
The best music that you want to hear. Morning, noon, and night. 94.3 on your frequencies. Number one in your heart. Qabayan Radio 94.3.
We are online for you 24/7. The People's Radio Station, Qabayan Radio 94.3. You're listening to Qabayan Radio 94.3, the first and only Filipino radio station in Qatar. With more than 257,000 unique audience and more than 60,000 followers, Qabayan Radio 94.3 FM is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@qabayanfm.com.
Live, online, on air, and on ground. Qabayan Radio 94.3.
Usapang Qabayan! Usapang Qabayan! Bibigyang linaw ang mga usaping nagbibigay ng interes sa mga kababayan. Sasagutin ang mga katanungan tungkol sa mga isyong may kinalaman sa mga overseas Filipinos. Magbibigay ng mga impormasyon at kaalaman para sa mga mamamayan. Ito ang Usapang Qabayan! Usapang Qabayan! Sabayang mapapakinggan sa radyo at mapapanood live online dito lang sa Qabayan Radio 94.3 FM.
A wonderful evening, mga kabayan. You are tuned in to the first and the only Filipino radio station here in Qatar, Qabayan Radio 94.3. Welcome to another episode of Usapang Qabayan. My name is Kenzo at kasama ko po ang aking partner,
RJ Andy, mga kabayan. And tonight, partner, we have a jam-packed episode for you. So we will be diving into a critical topic that, of course, affects us all. So, of course, road safety and injury prevention po ang ating main topic for tonight. And there's an addition to our enlightening conversation because we have a special treat for you. We also have a video recorded from Caroline Gabas, DHP nurse and educator, who will be contributing their thoughts and experiences para sa celebration ng Arab Nurses and Midwives here in Qatar, organized by Hamad Medical Corporation.
Exactly. And to ensure that everyone can tune in, we are simulcasting this episode on Qabayan Radio 94.3 FM frequency, as well as we are streamlining live on our Facebook page and available din po for viewing sa ating YouTube channel. So no matter where you are, you can join us and be part of this conversation.
That's right, mga kabayan.
Yes, and now let me introduce to you our very special guest for tonight. He is the director of Hamad Injury Prevention Program and a consultant at the Hamad Trauma Center, Hamad General Hospital. Dr. Consun, he is currently the director of Hamad Injury Prevention Program and consultant. So he is also an associate professor of surgery, critical care and health policy, and the academic, clinical, and administrative and research director of the surgical ICU and a trauma surgeon at the College of Medicine, Philippine General Hospital, University of the Philippines, Manila from 2003 to 2012 before he transferred to Qatar. He is a proud graduate of the Philippine Science High School, the University of the Philippines with a Bachelor of Science in Zoology, Doctor of Medicine and General Surgery, and Johns Hopkins University for Trauma and Critical Care and a Master's degree in Public Health. He has been awarded for his work as in the community, as a teacher, as a surgeon, and as a researcher. In 2006, he was also recognized as one of the 10 outstanding men or TOYM awardees for his contributions to medicine and community service. And of course, with his wealth of expertise in his particular field, he will be sharing valuable insights and tips on how we can stay safe on the roads. Joining us is no other than Dr. Rafael Consunhi.
Hi, Doc.
Hello, good evening.
Kumusta ka po?
I'm very well. Thank you. I'm very happy to be here actually. Thank you. Thank
Welcome
you for
back
inviting
po.
me. Yes.
Dr. Consunhi is actually our first, if I'm not mistaken, our first guest here at Usapang Qabayan.
That's good to know. So siya pala yung pinakauna talagang nag-launch ng Usapang Kabayan.
Yes,
di ba?
and this was over 2 years ago.
Yes, I believe. And hopefully this will not be the last.
Of course. This will be the very beginning.
Yes. So, Doc, let us jump right now to our topic. So, as the director of Hamad Injury Prevention Program, could you share some insights into the importance of road or safe road use for drivers, pati na rin yung mga passengers and vulnerable road users such as yung mga cyclists and pedestrians?
That's a very good question actually. So the first thing I'd like to put in everybody's mind is road safety is everybody's concern. It should be everybody's concern. Now let's say something that we do every day, that we are exposed to every day. I'm sure all of us, we at some point in time we will walk on the roads or we will ride a
Exactly.
vehicle. So it's very important that we know the very, very basics of road safety. The other thing I'll put into mind is sometimes we are so concerned about other diseases that are there, other health issues like say heart attack or cancer. But if we're going to talk sa mga kabayan natin dito, let's face it, ang mga kabayan natin dito, they're young people.
Yeah.
I don't think there's anybody in this station that is more than 40 years old. So that's one thing. So ang mga bata, the biggest threat to you is not cancer, not heart attack, not stroke. The biggest threat for you from a health standpoint is a motor vehicle crash actually.
Exactly.
Right.
So every year, Qatar loses more than 200 people who die on the roads, and more than 800 of them come to see us in the Hamad Trauma Center for serious injuries. This doesn't even count the thousands who come in for minor injuries. So it is very important that we all know really the very basics of road safety and injury prevention. And we'll go on to vulnerable road users after on the next question probably. But you have to bear in mind, the most vulnerable road user is the pedestrian actually. Kasi walang pumoprotekta sa iyo eh.
Right.
Pag nasa sasakyan ka, there's the car is there to protect you in its shell. If you're wearing a helmet on a motorcycle or a bicycle, you have the helmet for protection.
And then
Eh,
you have airbags and all that.
Correct.
Yeah.
protection.
Na kung meron ba naglalakad sa atin na naka-helmet o
Or naka-parachute.
none of us do that. So that's very important that the most vulnerable is the pedestrian, and actually the most severely injured patients we see at the Hamad Trauma Center are pedestrians. So we'll go to the basics. Do not cross the road where there's no crosswalk as much as possible. And then the basic, look left, look right. And then I'll add this very important point also. Bilang nakatatanda, bilang magulang, we have to set the right example for the young people. So around schools, wag yung, halika anak, nagmamadali tayo, dito na tayo tumawid. Nako, that is very bad because that will set a daily example for not only your child, but for the other children around. So set a good example, look left, look right, use the crosswalk. As much as possible, wear brightly colored clothes. If it's the evening, walk only where it's well lit or cross only where it's well lit. Because these are the most vulnerable people. And again, I would say every year we have severe injured pedestrians, probably in the vicinity of 150 people probably every year. To add on, so we asked about the other kind of vulnerable people are cyclists also, because
Yeah.
that's the second most vulnerable. Because again, they don't have protection. I know marami tayong kababayan mahilig magbike ng Sabado, Biyernes, ang dami ko nakikita. It's good, it's healthy, but it ceases to be healthy if it's not done in a safe manner. So as much as possible, stay off the main roads. There are many nice biking tracks here in Qatar. Again, personal protective equipment is very important. At the very least, a helmet. Now, they say, ang init, nakakasira ng buhok ko and all of these things, pero nakakasira ng utak ang mahulog or mabundol or
Exactly.
matamaan while riding a bicycle. So, the most important things are CPU. You have to protect the CPU, wear a helmet. There are helmets that have a lot of vents for ventilation. Take advantage of those. And these are things that they're designed to protect you from dying from a traumatic brain injury at the scene. They can reduce your chance of dying. Sounds so gory and dying at the scene.
Right.
But if I can tell you, by wearing a helmet, you can reduce your chance of death at the scene by as much as 90 to 95%. Then why
Wow.
not wear a helmet?
Yeah.
Wow.
Nagugulat ako na meron pang nagbibisikleta na hindi naka-helmet. Sabihin mo, yung bata pupunta lang sa tindahan, kunwari. That's still a risky time.
Yeah.
Again, give the right role, be the right role model for your children. Wear a helmet also whenever you go use a bike.
Lalo na yung iba yung sinasabi, no? Parang malapit lang
Yes.
naman, okay
Yeah.
naman.
It's ano, nakakasira ng araw, it breaks my heart when people say, but he was just going to the mosque. He was just going to go buy milk. And this happens they're talking to you in the ER or in the ICU, and you realize that small decision, or that decision to use or to not use a certain item, can really change your life and change your whole family's life for that matter.
Right.
And it's always prevention is better than
Correct.
cure. Right?
Thank you for saying that. all the time. That's our mantra really.
That's right. Well, moving on to our next question naman, Doc, no? Yung mga e-scooters and ATVs have gained popularity as alternative modes of transportation at medyo maraming nakikita natin dyan dito sa Qatar. So, ano po ba yung mga safety measures na yung mga riders dapat talagang they should follow para i-minimize yung mga risks associated with these vehicles?
Very timely ang question nyo about the ATVs, but we'll go to e-scooters first now.
Okay.
So the general rule for being safe on the roads is to see and to be seen. So that's number one. So if you're going to insist on using an e-scooter, which you can see my bias is don't use an e-scooter, because it's really not, it's again, you're unprotected. There's no protection. So the first thing is you should use personal protective equipment, not like what we use for COVID, but not only a helmet but goggles, kasi mapuwing ka lang,
Right.
you're gonna lose control of your
Delikado
vehicle. So get goggles or glasses. If you don't like me, I wear glasses. So and then if you can put pads on your knees and your elbows and gloves, and wear shoes, because all of these things are going to be able to protect you more. The helmet is the most important thing to protect your CPU. Now, make sure that you're not drowsy, you're not impaired. We'll say impaired, kasama na natin under the influence of drugs, under the influence of medications, or even if you're really tired, don't operate the vehicle. And then, may ilaw naman yung e-scooter natin. Kahit dito, it's so bright in the day here sometimes, ano. Pero na, medyo makulimlim. Turn your light on. You say it will sap your battery a little bit. It has been proven again that if you are seen by another motorist, your chance of getting hit dramatically reduces. So the first part is be in good shape, be in good mental and physical shape, and then make yourself obvious. So if you can wear a very bright reflectorized vest, if you can wear yellow instead of black, if you can turn on your lights regardless of whether it's the day or the night, that will make you significantly, let's say, less likely to be hit on an e-scooter. Punta tayong ATV ngayon. The first thing I will say about ATVs is ATVs are not toys. They are not for children. Have you ever ridden an ATV?
Yeah.
Yes.
It's fun, I can say yes, but it's very involved. You have to know how to move your weight. You have to know the power of the engine. You have to know whether it's inclined or not. A lot of these things are proven to not be the capacity or the capability of young children. So actually, the American Association for the Orthopedic Trauma does not recommend ATV use, recreational ATV use, for children below the age of 12. So a lot of people say, I borrowed it for my son, I borrowed it for my daughter. So we don't recommend that if they're less than 12, because they're for ating magaan sila, hindi nila kayang igalaw yung weight and they don't have the neuromotor capability. So and also by the law of Qatar, allegedly nobody will rent you an ATV if you're less than 18, and they'll check your QID for that. So if a parent rents a vehicle for the child, that's their responsibility, and sadly we have had victims like that. So that's number one. And then PPE is also, again, very important. Again, helmet, full PPE. Helmet, long pants, shoes, boots if possible, gloves, all of these things, again, will reduce all of your chance of injury. And then we also like to encourage everybody. The Qatar Tourism Authority has a beautifully laid out track that is set up specifically for ATVs. It has 5 levels of skill. It has from the beginner, there's a ladies section, there's intermediate, there's advanced. And they grade that every day. They make sure that it's safe. So this is a controlled environment. So you can have fun because if you go out anywhere, one thing is you don't know, there'll be a drop and you can.
Exactly.
So that's one thing. And then 2, you don't know who else is in the area. Well, yesterday, a pedestrian was actually hit by an ATV. We've had people hit by off-road vehicles, usually SUV. So you don't know, or so if in the dark more so. So these are things that we want to avoid. So staying in that controlled area will provide you the opportunity to have fun, but do it safely. And then lastly, most of them don't have lights actually, or if they do have lights, they're not the best lights. So we don't recommend using it at night on the roads more so, because they're not designed, again, iba yung traction ng ATV on the road as versus and you've ridden it. So it's a different ride. So if you must insist on using an ATV, I think it's a family decision and the parents should be involved. No kids, really. Very important. So that's very important. We'll emphasize it because as of last year, in the past 2-3 years, we've actually seen a slight reduction in the number of injuries. Pero nakakaanong lungkot, 40% are children. Yes. So 40% are children less than 14. And then dumadami ang babae. Well, females are getting more adventurous.
Yeah.
But you know the downside of being a female? You're lighter. You don't, kasi ako, I weigh 200 pounds. Kayang-kaya ko yung igalaw yung ATV. But if you weigh 80, 90 pounds, you cannot move it adequately. So I'm not saying women don't have the skill. I'm saying you might want to think about it, maybe getting a machine that is lighter, that has lower capacity. Kasi
Right.
malalaking makina ng iba eh.
Yeah.
And it's very timely kasi ngayong season na to
Yes.
is the camping season.
Yeah.
And many people go outdoors
Correct.
and enjoy these kind of activities. So talagang very good mga insights na nakukuha natin kay Doc about, safety tips on how to use ATVs during this particular time of camping season. But apart from ATVs and e-scooters, isa sa mga madalas na nating nakikita ngayon sa daan, yung mga motorcycles.
Yes. Correct.
They are a very common sight in Qatar. So what are the essential safety tips for motorcyclists to ensure their well-being and, prevent accidents?
Okay, I'm going to be repeating myself again, but PPE.
PP.
Natutuwa ako actually here, the motorcycle delivery companies, and we work with Talabat very closely, they insist that each and every one of their drivers, and you see the bigger brands, I won't name other brands, I'm sorry, but they all have the proper kit. They all have the full plong pants, the shoes, and everything. So that's a requirement. Now, for those who drive it recreationally or for commuting, you must have the same standard. Helmet all the time, full face visor if possible, gloves, shoes, and long sleeve pants and long sleeve shirt as well to prevent the road rash, we call it. So that's one thing. And then C, again, so you have to be in good physical and mental state of mind, and be seen. So the simple act again of turning on your headlights. In many countries in Western Europe and in North America, states in the US, there's a requirement. The minute you start your ignition, you have to turn on your headlight. And some of them, it's yoked. When you turn your ignition on, the headlight is turned. Why? Again, it's been proven that you are going to be more likely to be seen and less likely to be in a crash. That's one thing. So that's one thing. And then again, if I have a choice between wearing something black or something nice, beautiful, like pink like that, not that I'll wear pink, but it will be great if you're in. That's why you look at all of our motorcycle delivery drivers, it's very bright
Yeah.
neon, bright. And then I like what they've done recently, the delivery box behind them, they've lit it up. So these are all things. So if you are more likely to be seen, you're wearing your protective equipment, and then we'll add on other things also. This is something that we've been struggling with this. They're in a rush. Us, the consumers are telling, hey, where is my delivery? Where is my order?
Mga orders.
Let us,
Right.
as the public, try to relieve the pressure on them.
Yeah.
Try not to be so, where is it? I want it yesterday. So this stresses them and it forces them, it pressures them to drive faster and maybe not as safe. So that's one thing we can do. And then the other thing also, if we see them on the roads, I always give them way because, again, we go back to the term vulnerable. Between me and my car and him on his motorcycle, he's more vulnerable.
Yes.
Kung magkabanggaan tayo, talo siya, syempre. So, I try to give him way as much as possible. And then, there's one thing that we're trying to also set, because we're collaborating with the National Traffic Safety Committee, the Traffic Department, Qatar University, and all of the delivery driving companies. We want to get anti-lock braking systems in all of the motorcycles. It sounds very nerdy, but this anti-lock
Okay.
braking system, essentially it's something that will prevent you from skidding if you're forced to stop suddenly.
I see, okay.
So again, this has been proven to significantly reduce your chance of severe injury, coming to see us in the trauma center, or worse off, dying. So
Yeah.
it's an additional cost for every motorcycle, but it's not yet here in Qatar. If we could make that a regulation that you cannot use a motorcycle in Qatar that doesn't have anti-lock braking systems, we will significantly reduce the number of injuries we have for motorcycle drivers.
Right. You've been mentioning about PPEs and safety gear since earlier on. Ngayon kasi, hindi masyadong issue yung pagsusuot ng
Because it's
madaming
cold.
because of the
Yeah.
weather that we have now. But during the summer period, ito yung mga issues ng mga nagdadrive,
Yes.
especially motorcyclists. Are there available safety gears or PPEs that would allow them to, not experience
It would
that
be very
terrible heat?
convenient for
Yeah.
them as well.
Actually, that's a very good suggestion, because actually the ILO working, I think, with QF has done this for the construction workers here in Qatar. So they've done a number of things. One is they don't allow them to work at least between 10 a.m. to 4 p.m.
Yeah.
outdoors. So actually, voluntarily, the delivery companies have made rulings that during certain months, they don't allow them out also. And they will actually warn you when you try to order. Your order might be later. And
I see.
they will put them preferentially in cars to deliver your groceries or your food so that they're not as exposed to the heat as... But going back to the workers, so what they've actually created is a vest that actually is a cool, has a fan in it. That could be something that we could recommend, or we could potentially think of, let's call it, applying to motorcycle drivers here also. But so far, what they've done is reducing the number of trips, reducing or restricting the trips during the peak hours in the summer, putting them in cars so that there's an AC at least to reduce their heat stress and chance of heat-related illness. Now, the personal people, the people who drive recreationally or for commuting, that's up to them already. But
Right.
but I don't think it's nice to be recreationally driving a motorcycle in the summer here. But that's their
Exactly.
choice.
Okay.
Yeah.
Okay.
All right, so napag-usapan na natin yung summer. Dito tayo, our next question focuses on driving in challenging weather conditions, and magpapa-winter na tayo, and we've experienced, rainy times and of course foggy weather. So it's gonna be quite challenging, no? So, Doc, ano yung mga precautions natin that drivers can take to navigate safely under such conditions?
Dapat wala na ako sasabihin sa mga kabayan natin, sanay na tayo magmaneho sa ulan. 40
Exactly.
days, 40 days and 49. So what I will warn you is, ang mga kasama natin sa kalye, hindi sanay sa ulan yan.
Oo, totoo.
Diba? Hindi sila sanay sa ulan. So they are not as bihasa or as good as us at driving in the rain. So we have to give them a little bit of leeway. They don't know that the stopping time is with your wet brakes and a wet road. The braking distance is more. So we should know that we keep a longer distance in the car in front of us. And then I'll go back to see and be seen. So to see well, you have to have your wipers in working order. So it's time. If you haven't checked your wipers the whole year, go out now. Maybe after the show, go out and check your wipers. Wipe them with a moist cloth and see, are they still flexible? Run them through your, and see, yung maingay na, it's time
Delikado
to
na
change
yun,
it.
Doc.
Yes, because that will be worse in the rain because it will actually obstruct what you're seeing. So that's funny. Clean your windows, clean your wipers, and then turn on your light. Again, another thing that people don't realize. Many places also, the minute that you need to use your wipers, the requirement, and you can get a ticket for this, is you turn on at least your running lights. Again, to be seen better.
Right.
So the minute na makulimlim and you start to need tumapatak na, when you turn your wipers on, turn your lights on also. But don't turn
Okay.
it on bright because that can be a hassle. But you want to increase your visibility, so turn that on as well.
Okay.
So it's very important from the safety standpoint. So go like braking distance, wipers, windows, and turning on your lights. That's very important for the
headlights or just the
You can do your running lights at
Right.
least, or at
Okay.
least headlights on low. Don't put it on bright.
Okay.
Iba na yung usapan when
Yeah.
we'll come back, maybe talk about fog in a few months time, but that's another set of things to recommend for foggy weather.
Right. And balikan lang po natin, Doc, about yung mga vulnerable people.
Okay.
Those who are driving, those who are in the pedestrian. What I can commonly see are people who are wearing headsets, mga headphones, lalong-lalo na yung mga nagwa-walking, nagsa-cycling,
Yeah.
doing recreational activities, talagang mga naka-headset sila. So, ano yung mga potential risks involved? And can you provide us, an advice on safe practices sa paggamit ng mga devices na dito?
Okay. Very realistic question. If you get into your Uber, whatever you ride, your Carwa, whatever it is you're riding, and the driver has headphones on, I will tell you, insist, I'm not going to take this ride until you take the headphones out. Because you need 100% of focus.
Yeah.
Okay? Would you want me to do surgery and yun? I'm listening to my podcast or Qabayan radio.
Nakakatakot yun, Doc.
See? I'm not, you don't want me to do that. So it's as
Yeah.
important, my safety and yung aking kapakanan is as important should be to everybody, and not only yours in the car but everybody else around. So you don't want him or her to be distracted by and you want him or her to be able to use all 5 of his senses to be
Yeah,
able.
yeah.
So I cannot recommend it for driving. You can put it on the radio actually if you want. You can Bluetooth or whatever it is that you use for it, but don't put it in here because the other thing is that I find that if the driver has this in here, the tendency is if he gets a call, he will answer it. And that's the last thing. Distracted drivers are the same as drunk drivers, and they say having an ongoing phone call with somebody is the equivalent, and they have BAC, the blood alcohol concentration levels. It's the equivalent of being not only impaired but intoxicated. So if you will let me perform surgery on you while I'm drunk, then go ahead and drive with that Uber driver who has the headphones in and is carrying out a conversation. Because you have a right. You have a right to get to your wherever you're going safely. And if it's not going to be, it doesn't look like it's safe, you have the right to get out and say, no, I'm canceling this. I'm not going to. If you're going to do that, I'm getting off. I've done that a number of times. Kasi importante. So that's for driving. So driving, for me, absolute zero. No distractions. You have to be 100% focused. I would put the same for on an e-scooter, on a bicycle, or on a motorcycle. All of these. Because what is more important to you that you have to keep doing instead of driving from point A to point B safely? It can wait probably. Now, if you're walking or you're running, and let's say you're on a path that doesn't cross the street, that's fine. That's why when I run only in one place that I will not cross the street. If you're going to be crossing the street, then that's another issue. Because you need, again, your full. People say, Mo, but I have the volume low or I only use one ear. I will tell them that is still far from optimal. Maybe if you use one ear and your volume is low, maybe that. But again, given a choice between, again, you want your pilot on your plane to be distracted, or do you want him or her to be fully focused? That's what. So if it's important for you to be safe on the roads, there should be no compromise.
Kasi naiimpede talaga yung
Yes.
Kasi naiimpede talaga yung hearing natin, no? Lalo na hindi natin narinig yung mga busina.
Correct.
Yeah.
So
I mean, kung naka-metro ka pag mag-commute, okay lang. The metro is fine. There's no risk on the metro, di ba?
Actually.
Mababangga sa'yo ng ganyan. But on the road, hindi mo alam. And if you can't hear it, then your reaction time is slow and things happen.
Ayun. So thank you so much for emphasizing on being fully attentive on the road. Now, let's shift gears a bit, mga kabayan. Napag-usapan natin yung kanina, yung camping, because it's winter time at maganda na yung weather natin. So, camping and outdoor activities dito po sa Qatar, which are of course enjoyed by many, no? So, ano yung mga safety guidelines natin, Doc, na dapat yung isang individual is kailangan niya talagang i-ensure na safe experience while engaging in these kinds of activities?
I think siguro the first thing is, lalo na kung mag-isa kang pupunta, have somebody else know what you're going to be doing. So that they know where, at least pupunta ako sa past Alcor, pupunta ako sa North, pupunta ako sa East. So that alam ng tao, and then say, I expect to be back by tomorrow or this evening.
Okay.
Kasi kung mawawala ka, hindi ko alam, saan ka ba nagpunta? Saan ka hahanapin? So that's one thing. So make sure somebody knows where you're going, know where you're going also. That's very important. Because our colleagues from the ambulance service are very, very good, but they need to also have an idea where to look for you and where to. Exactly. That's number one. If you're gonna set up a camp, the idea is wala siya sa daanan. So only in that is designated or allowed, camping is allowed. Put up your tent and everything. Kasi for one thing, they're concerned about the environment, the conditions around it, and then you don't want to be sa daanan ng mga sasakyan. And then number three, if you're going to set up a fire, there must be a distance of at least 2 to 3 meters between your tent itself and the fire. And then before you start your fire, you have to be ready with a bucket of water in case you have to put it out. And if you don't have the water available, a bucket of sand. Remember, sand is as good as putting a fire out as water. And sometimes if there's oil actually involved, the sand might be even better. And then don't leave yung really the embers and then you go to sleep. That can still, pwede pa ring lumiyab yan, pwede pa ring mag-cause ng, it might light up again. So the idea is, don't leave them, kill them fully. And then, once you're sure that everything is out, then you can go to sleep and you can leave it. Now, if you're going to be sitting around it, you're going to be watching it, fine, keep it there. So the important things are in the right place. Don't be kung saan-saan lang. Make sure people know where you are, because let's say something happens, so that when you call, because the no 5 to stay alive from the ambulance service is, one of the first things is, where are you? So at least you can give them an idea. So that's very important. And then the fire hazard is number one, and then other vehicles or other things around it. Isisingit ko yung drowning prevention ng contagion. Mahilig mag-fishing. Mahilig mag-fishing ang mga kababayan. Crabbing. So, don't do it alone again. Kasi, something happens. You have a cramp or something, and better may kasama ka. So, if you need help, that's one thing. Or at least somebody knows where you are. And then, if you're really going, kung papasok ka talaga sa tubig, although malamig, I don't know kung papasok, better meron kang flotation device and something bright colored again. So in case somebody has to come and rescue, they can see you and you're floating. So these are basic things. So there's strength in numbers, so don't go, wag kang solong bumiyahe ng mga ganyan as much as possible. May kasama ka to help you or somebody knows where you're going. Very, very basic.
Two is better than one.
And maganda din na may alam kung anong oras yung oras na umuwi, para just in case you are not home yet, they can already try to contact you.
Medyo mag-aano sila, yung mag-aalala sila.
Yes.
Somebody will watch out for you.
Yeah, thank you so much, Doc Consunhi, for sharing those valuable tips regarding outdoor activities. Ngayon, moving on to our next topic. Ito yung mga pang-prevent sa atin, no? Para hindi tayo masyado masaktan sa aksidente. Ito yung mga airbags.
Okay.
Can you explain some of the types of airbag injuries? Kasi meron ding mga talagang nasasaktan because of the airbags.
Yeah.
So, ano yung mga common types ng mga injuries na yan? And what are the recommendations on how to prevent those injuries?
So the first thing, I will give you the really nerdy name of airbags. Airbags are supplemental restraint systems. Kumbaga, dagdag siya na para pigilan ka sa kinaupuan mo. So they do not work alone. They will only work if you have your seatbelt fastened. Because if you are flying and you're not restrained and you hit the airbag and the airbag is coming out at more than 100 miles per hour,
Right.
that you end up with a worse injury. Because I've heard people say, "Hindi doc, hindi ko kailangan ng seatbelt. May airbag ako eh." That's a very wrong premise. Because you're flying and then the airbag comes and hits you. There's a side curtain. You end up with a worse cervical cording. It will
Right.
only work to protect you if you are firmly in your seat because you have your seatbelt in. So that's very important. There are different kinds of airbags. There's a side curtain. There's the ceiling. There's the frontal impact, which is most common in.
Right.
So when we talk about airbag injuries, there are two types actually. So one is the airbag injury that happens to young children. So do not put young children in the front seat.
Yeah.
Lalo na infants, because the airbag can come out and they can actually get smothered and be unable to breathe or have a cervical cord and they can get paralyzed because of that. So no children, no infants in the front seat, even if they're in a car seat, because the airbag can come out.
Children of which age?
I would say toddlers up to 2 years of age.
Okay.
But strictly speaking, we don't want children below the age of 13 in the front seat.
Yeah.
Okay.
Exactly.
Adults only in the front seat. I'll add on something else bago ko malimutan, no? Many of us, and I see this all the time, papasok tayo sa Uber, dun tayo sa likod.
Right.
Okay, mama, pupunta ako saan? Siyempre, hindi ganun sasabihin mo. Pero, I'm going to Al-Sad, whatever you're going to say. So, and then, they forget to put their seatbelt on.
Yeah.
The law of Qatar requires that front seat passengers, driver and front seat passenger have a seatbelt. Why? Because you don't want them to be ejected. In the event of a crash, you don't want to be hitting your head on the steering wheel against
Right.
the windshield. Because if you get ejected from a vehicle, local data, our research team has done this, you increase your risk of death by 5 times.
Wow.
So that's the difference. Okay? What about the people in the back? The law of Qatar doesn't cover the people in the back yet, but the law of physics covers all of us. So if I'm going to be flying from the front seat, am I not going to be flying from the back seat?
Exactly.
So every time you get into the back seat, the wisest thing is also put on your seatbelt because the law of physics covers all of you in the car.
Yeah.
So me, when you ride with me, they say, no, I don't need one. I need that because I don't want your 60-kilogram body coming towards you if somebody hits us, correct?
Exactly.
So I'm protecting myself by you putting your seatbelt on. You don't care about yourself, I don't care. I care about myself. Even if I just throw this globe at you right now, your chest, sakit, you might break a rib. If I
Right.
throw 60-kilogram person at you, that's going to also cost you. So it's very important that even the backseat passenger, all passengers actually should be restrained. So we'll go back to airbags now. So we talked about the first set of airbag injuries that can affect young children and infants because of being smothered. Now the second one that I'll try, and I don't know, perhaps only our video audience will see this, but at least you can hear this. Open it and take a look at it.
Okay.
So we had a spate. Dr. Sherwan, one of our consultants in trauma surgery, collected data on 6, and now we have eight patients. So if we can show the audience that looks like if you've ever seen a shotgun shell, it looks like a shotgun shell, no? It's a
Yeah.
piece of metal. We've had a collection of 8 patients now, 2 of whom unfortunately died, who succumbed to their injuries because they got into a crash which is rather minor actually, but it was strong enough so the airbag deployed. And this piece, which is from the canister, because essentially when an airbag deploys,
Yeah.
it's like an explosion. It's almost like a shotgun shell going off. So that metal canister came hurtling out at them. So we were they were puzzled at first because when you're in the ED, you know what is a blunt injury and what is a penetrating or gunshot wound. So this is weird. I come in with a car crash, but it looks like somebody shot them. That's because this came out. So we studied it actually. So this is a call for everybody to sit down and Google now and put in my car airbag recall. Because you want to know if your car has been there's a notice out for the airbags of your car, whether they're recalled or not. So we found that all of the vehicles that we had in this six patient series, all of them are older vehicles, at least 9 years of age, and all of them had been part of an airbag recall already.
Okay.
We were unable to ask all of the patients, all of the victims themselves, if they knew about the recall, but as far as I know, I've been here 10, 11 years, I've never seen a call in the newspapers for an airbag recall. And you'd be surprised, I'm not going to name names, but some very common vehicle brands have had airbag recalls already. The reason why the airbag is more likely to have problems in this country is because it's warm, it's humid, and these are things that can foul up and can make your
Deteriorate,
make your airbag propellant and your airbag deployment defective, and that's what happens. It's like somebody shot you with a shotgun, but actually what's this? Most of them were very surprised because it was like a small crash only, but we had like somebody had to open the chest, we had to do something in the neck because these are projectiles. It's like somebody. So if during listening to this, if you have time, Google your car, make and model, airbag recall, and find out. There are many websites that will tell you whether or not your car's. And then if it is indeed been recalled and it has not been changed yet, you are supposed to be able to go to your manufacturer and say, manufacturer A, look, I know it says here my model of car has a defective airbag that should be replaced. When can you replace it? And it should be free of charge.
Right.
Kasi peligro talaga. I mean, what should be a supplementary restraint system to help you survive and not be injured in a crash can become a cause of more injury. Or in the cases of two of our patients, they died.
Yeah, especially if it hits your vital organs.
Yes, precisely. So that one of them, it went to the base of her skull, and that's why she succumbed. So this is why we think it's very important. Again, so ang kulit ko, no? Sit down and Google now. Put your car model and make in airbag recall. Yes, do it.
I-double check nyo po.
Kasi, but yun nga, if kung makabago ang kotse nyo, most likely hindi na sila naabutan, hopefully ng recall. But this is the only way to check. That's the only way to check. So that hindi ka namimili, hindi ka nangangaba na, oh, what if my airbag deploys? It could kill me.
Right.
Make sure. That's a very simple thing to do.
Pero maganda yung sinabi ni Doc na terminology about airbags. No? It's a restraint system. Kasi
Supplemental,
usually,
pandagdag.
Kasi usually, inaano natin, iniisip, parang ang ganda kasi pakinggan ng airbag. Parang it's something that will not hurt you.
Yes.
Pero nung narinig natin yung supplemental restraint system, parang it's something more serious.
Yes.
And it's designed to work only if you have a seatbelt on, if you're restrained.
Right.
Because if you're flying across the car and the airbag deploys, it might cause further injury.
Right.
So we tell everybody really that it's supplemental, that you should know where they are in your car, and that it only works with the seatbelt when you're using your seatbelt.
By the way, Doc, may nakisali sa ating mga listeners dito sa ating live, no? May nagtanong, is there a specific age or height requirement for children to sit in front of a car in Qatar? Kasi different countries have different policies, and I often observe children sitting in the front seat even when their necks can't properly reach the seat belt.
Thank you for that question. Now I'm going to have to go. So ito medyo masakit na sasabihin ko na, but you know the most common form of child neglect in this country? Having a child in the car not restrained. I see it every day. I see it too many times, and we see the results of it, unfortunately. So the first thing is, the rule of Qatar is 10 years and below should not be in the front seat. Kung sundan lang yan, ang dami na natin. We will save so many kids from unnecessary injury. So that's at the basic. Below the age of 10 should not be in the front seat. That's legally by Qatar's law. But the global recommendation is no less than 13 years of age should be in the front seat. And then it's not simply that. I'm sorry. Meron tayong mga kababayan na hindi masyado matatangkad, but you should be able to sit in the seat, and you should be able to fold your knees.
Yeah.
And you should be able to lay your feet flat on the floor.
Okay.
Kasi kung medyo hindi ako masyado matangkad, nakaganyan ako. I'm not tall enough. No, I'm not tall enough really. And then you should be able to sit your butt all the way to the back and do that. Because if you can do that, kasi if you notice, the front seat is a little longer than the rear seat.
Yes.
So you need a little bit, medyo dapat mas mahaba ang ating hita, ang ating thigh ng kaunti. So yun ang kailangan. Kasi if your legs are dangling and you cannot fold your knees this way, then it's still better for you to sit in the back seat. So again, recommendation 13 and above. In Qatar, 10 and above. But the safest place is in the middle of the middle seat of the rear row with a seatbelt, or if the child is younger, in a car seat.
Okay.
So ibang usapan, I can talk to you for 10 hours about car seats. Maybe we should schedule that another time. But
No problem, Doc.
May naisip nga ako, Doc, yung bang placement nung, kumbaga, yung sandala natin, okay lang ba siyang medyo nakapahiga ng konti or kailangan straight up?
So physics tayo, no? So, so nerd talagang guest yun. Sorry. The way that seatbelts and cars are, the most common crash is a head-on frontal collision. So, when they say your car has a 5-star crash rating, it's because they tested it in a frontal and a little off-frontal collision. So, that's again with the dummy in the upright position. So, I'll tell you, if you lean it back, you recline,
Yeah.
your 5-star crash rating, medyo bumababa na yan. They cannot ensure you that 5-star crash rating will apply to you. So as much as possible, when they do this crash test, the dummy is in upright position. So pagod ka, you're the driver, you're the passenger on the side. Sure, you can lean it back, but bear in mind, and again, that your crash rating, the assurance from the manufacturer that you will be protected in this vehicle, it goes out the window.
Yeah.
If you file a lawsuit, potentially they'll say, but you weren't. This is the way. When we say 5-star crash rating, you're sitting upright, you've got your seatbelt on, all that. So it's not the safest thing to do because it has not been tested and the vehicle has not been credentialed or certified that if you're leaning back by 45 degrees, you'll be as safe as if you're 90 degrees up.
Right. How about this particular scenario? Kasi
Sure.
syempre minsan bago tayo ma-aksidente, nakita na natin that it's gonna happen. And one of the reactions that we usually have is to cover our face. Or di kaya kapag nagda-drive tayo, nililiko
To swerve.
natin siya, di ba? So, would that have an effect with the airbags kung sakaling bigla kong i-swerve yung sasakyan and then nag-deploy yung airbags?
So the airbag has sensors in there in the front bumper. So if a sufficient force hits the airbag, then it will deploy. So potentially, if you're able to veer off well enough, your frontal airbags will, but
Okay.
the impact might come on the side. And if you have a side curtain, then
Okay.
that might deploy. So bear in mind again, the frontal airbags is designed for a frontal collision. I will not recommend, sige, hayaan mong bumangga ka ng harap.
Yeah.
Just so that
Yeah.
if you can swerve, then swerve by all means because that will reduce the force that is going to be
Yeah.
impacted on you. But your frontal airbags actually might not deploy in that case.
Okay.
Which is not exactly a bad thing kasi
Yeah.
nakaiwas ka eh.
Yeah. Parang naisip ko po kasi minsan kapag ka nagganon, baka biglang mag-deploy yung airbag since nasa harapan natin yung tatama yung kamay sa muka.
Well,
Hindi-
I'll tell you, it will happen so fast you won't notice. But the thing there is, kapag, ibig sabihin, pag deploying airbag, kung umiwas ka, ibig sabihin, you still got hit in the front. So,
Yeah.
I mean, between you and me, and a lot of other people, we can fix you have a fracture in your arm. That's easy to fix. Well,
Okay.
it's going to be painful, but the thing is, as long as you're able to reduce the force that hits
Yeah.
your
Okay.
vehicle, because this is the most important thing. We cannot
Alright.
repair your
Yeah,
brain.
Alright.
your brain.
Protect your brain.
Right.
I'm not saying okay lang mabalian ka. Mas okay na mabalian ka, but we were able to protect your brain.
Yeah.
This is the
Okay.
thing that we
Exactly.
cannot repair. The neurosurgeons try very hard, but
Yeah.
repair is still not great. The
Yeah.
results are not great.
Okay.
All right. Thank you so much. Since napag-usapan natin yan, I'm inviting our listeners, our viewers right now, kung meron po kayong mga questions, feel free. Ready po dito si Dr. Kunsunhi para sagutin kung ano man yung mga tanong nyo. Anyway, Doc, so meron kang shinare sa akin, no? I think this was a week ago. We have an exciting event upcoming, and we call it Qatar Health Congress 2023 and the third Qatar Public Health Conference. Doc, could you please provide our listeners and viewers with details about the conference and kung meron mang scheduled dates na?
So Qatar Health 2023 and the third Public Health Conference of Qatar will be held starting the 23rd of November up to the 25th. So that's Thursday, Friday, and Saturday next week. We will have pre-conference courses starting on the 22nd and the 23rd also. For those of you who work in healthcare, maging nurse, doktor, administrator, PT, OT, RT, EMT, paramedic, this is all for all of us in healthcare in Qatar. We consider this to be the sentinel or the landmark event every year. Nahuli lang tayo this year. It should have been in February, but we're holding it in November of this year. So the good thing is that if you attend everything, you can earn as much as 28.5 CPD points. If you get into the pre-conference courses, you can add another 4 more hours. So the maximum you can earn actually is 32.5, which I think is a significant number. Now, the important thing is the theme is updates in managing complex diseases. So there have been a lot of things that have happened since COVID, and we've been unable to have a really good meeting. So we put together updates not only from local experts, but we brought in a lot of international experts. We have people from locally from the Ministry of Public Health, who's a very big partner. So we'll talk about not only clinical but public health. We have the people from Qatar University, PHCC, as well as even Weill Cornell and Sidra. So we have, you name it, the big healthcare institutions in Qatar will be here. And then we also have speakers from the WHO, from Geneva and from Cairo. So there's something for everybody. You will learn a lot, and you'll say, I think you will have problems because we have 5 tracks going on at the same time. Mamili kayo kung anong gusto nyong matutunan. And then the other thing is we have both online and in-person attendance. You can earn the same number of CPD points whether you sign up for online or you sign up for in-person. So it's something for everybody. Updates that are very important, a very big event, 23 to 25 November.
Can you give us, Doc, some sneak peek on what are the topics and things that will be discussed in
So for
this
instance,
Congress?
we had a lot of mass casualties and disasters. So we have a big track on mass casualties and disaster preparedness. Like somebody will be talking about how they dealt with the flooding in Pakistan, how they dealt with the earthquakes in Turkey. So that's part of it. And how they prepared for the World Cup here in Qatar. Which we have, knock on wood, did not have a mass casualty event or any disaster, but how we prepared for it. So these are some of the things. And then, for instance, mental health is becoming a very big issue, really. As an offshoot of the COVID and everything, the Ministry of Public Health has put together a 2-hour session just to talk about what they're doing and what we can all do as healthcare professionals to improve and to treat patients with issues with mental health. The Ministry of Public Health also has a very interesting take on climate change and health, which again is a new field in healthcare, because we used to think of them as 2 disparate fields. Now we're going to put them together. What is going to happen? Because it's inexorable. We can't stop it anymore. Climate change is happening. What are the health consequences of climate change? From the trauma standpoint, we have a lot of trauma updates. We've got international speakers from the US, from Europe to talk about different surgical approaches, different ICU approaches, different trauma systems. So we have that also. And then, of course, from surgery, we have thoracic surgery, orthopedic surgery, bariatric surgery, lung transplant. From medicine, we have endocrine. We have everything, almost everything.
Okay.
The major things are there. Again, something for everybody. Kung wala kayong matutunan sa isang oras na ginugol nyo sa Qatar Health, come and see me, I will give you a refund. I'll tell you, it's a very, very fruitful conference. You will really learn a lot. Sayang ang pagkakataon to learn and to earn your CPD points.
Yeah, thank you so much, Dr. Consuni. Very interesting yung mga topics na nabanggit ni Doc, no? So I'm sure that all of the healthcare professionals out there who are, who'd want to expand their knowledge and, kumbaga, understanding about the current trends din sa healthcare, all you have to do is go and register for this particular conference, and I'm sure that you'll be learning a lot from
It's a great
experts
opportunity for
around
you
the
guys.
world. Yeah. It's a
Learn
good-
and earned. Right?
Yeah. And speaking of an event happening really soon, meron pang isang event that it's happening tomorrow. It is actually the World Day of Remembrance for road traffic victims. And could you please share with us, what are the objectives of this year's observance?
I'm sorry, thank you for bringing that, but I'll apologize. Nakalimutan ko kasi dapat
sure.
last week tayo, di ba?
Yeah,
Dapat last
yeah,
week
yeah.
tayo.
So, was this last week?
No, dapat last week.
Okay.
Nakalimutan ko idagdag sa lineup natin. Then I realized as I was preparing yesterday, it's tomorrow. So tomorrow, November 19. Thank you for including it.
No problem.
There's a
Doc.
global event that happens every year, the 3rd Sunday of November for every year. And we've been holding this in Qatar since 2014 or 2015. So we join all of our colleagues in the world who work for road safety, who take care of patients who are victims of road safety, on the World Day of Remembrance for road traffic victims. So what is this day? So sadly, all of us have been personally affected by somebody who either severely injured or who died in a road traffic crash,
Yeah.
had a road traffic injury. Worldwide, actually, they say 87% of respondents in a worldwide survey said that they know of somebody who's died in a road traffic crash, and 95% said they know of somebody who's had a severe injury. So this is something that hits all of us. So for the World Day of Remembrance, every year, it's actually a whole week of activities. This year, the National Traffic Safety Committee, the Ministry of Public Health, Hamad Trauma Center, Qatar University Transport Studies Center, and also the Traffic Police, we're going to launch a social media campaign tomorrow to help people remember, support, and act. So the first thing is remember. Take a minute, take a second to remember all of the people who have passed or been severely injured in your lives and across the world. Because this is literally 1.5 million people die every year from road traffic crashes. It's not a nothing event. So this is one. Take time to do that, and then support. So support any efforts that are going on in your community, efforts from your local government, from your even within, like you work in a school, you work in a business, and they say, we want to do this, we want to We want to go out into the community and teach them how to cross the road, children to cross the road. Support these efforts, support legislation and laws, follow traffic rules. These are very things. And then the last thing is talking about ACT. So very important for me is the ACT is, so for your own personal safety, the first thing that I think you should do every time is click your seatbelt. Very simple act, right? So click your seatbelt. And then I'll extend it further. If you're going to drive a bike, ride a bike, drive a motorcycle, get on your e-scooter, put on your PPE. So the action is to prevent further victims of road traffic injury. In a perfect world, this don't happen. But we don't live in a perfect world. So let's try to push it to as much as possible. Let's put the Hamad Trauma Center out of business. One day we hope, one day we will come to work and there will be nothing for us to do.
And Doctor
Yung
will be,
maboboard na
Dr.
sila.
Soon he will be changing career.
Yeah. He's gonna be a radio broadcaster.
One day we hope that will happen. So, and then the last thing about acting is, again, don't forget that you are important people in someone's life. You are a role model for a child, for a younger person, for a younger colleague. Act in a manner that is suitable or should be, dapat siyang parangalan, dapat siyang gayahin.
Yes,
Right.
yes.
So, yun. Show the good behavior. Don't talk on the phone with your kids in the car. Don't talk on the phone ever, regardless if there's somebody in the car while you're driving. Don't be distracted. Hand the phone. Oy, may tumatawag sa akin. Tumatawag si mami. Sagutin mo nga para sa akin. Hindi ko gagalawin yung telepono na yun.
Yes,
Or magmamaneho ko, hawakan mo para sa akin. O ano ng directions sa atin. I am not going to be, that's the worst thing you can do. Because it sets an example. It normalizes behavior that should not be done really. So very important.
Yeah.
And then going back to the seasonal thing, please don't let your children ride in an ATV. Very, very important. We don't want to see any more child victims of ATV crashes. So it's very important.
Right.
Kung we're going to go back to the seasonality of it. So World Day of Remembrance tomorrow. Take 5 minutes tomorrow. Remember all the people you know have been severely injured, who have died unfortunately from a road traffic crash. Remember, if there's anything that's going on to improve road safety in your community, support it. And then lastly, act. And I will give you act. May baon pa ako. I'm going to give you.
Wow, thank you, Doc.
These are. I hope you put this in your car. So
Yeah, sure.
This is our thing from Hamad Trauma Center. And
Ito po, mga kabayan.
It says, seat belt save lives. Fasten yours to stay safe.
There you go.
It is a message from the Hamad Trauma Center.
So the most simple, the easiest thing to do. Kasi lahat tayo. And again, uulitin ko, kung sumakay ka sa likod ng Uber, mag-click ka pa rin. Kahit nasa likod ka ng,
Ano?
nasa likod ka ng taxi, mag-click ka pa rin.
Yeah.
Pag nakikipag-usap, nakikipagkwentuhan yung driver mo sa Uber, sabihin mo, wait, I don't want you to drive for me if you're unsafe. Please. You can do
Ganon.
that on your own, but not with me in the car.
Doctor, do you have like a social media wherein you post certain
Blogs or something,
recommendations
perhaps? Yeah.
or safety tips, something like
Well-
that? Because that's something that they can also do tomorrow, or actually anytime. They can post it on their social media to raise awareness.
Spread the word.
Yeah.
Thank you very much for that. So we're not allowed personal social media accounts. So it's going to be through HMC. HMC is going to start releasing special social media messages, not only for ATV safety, but also around World Day of Remembrance. And of course, there's a national campaign headed by the National Traffic Safety Committee.
Okay.
So we're going to get the release of that, and I will share it with you as well.
Sure.
If you could repost and
Yeah,
retweet it to
definitely.
all of
No
your
problem.
all of your
Definitely.
different media outlets or whatever ways that you get things out on social media. That
Yeah.
will be very helpful and supportive.
Yeah, sure.
All right.
Yeah, we'll do that.
I was actually about to ask for his final message or advice, but basically that's it. Nasabi na ni Doc. But if you have any final message para sa lahat ng mga listeners and viewers na nakikinig at nanonood sa atin, Doc.
More so sa mga kabayan natin, nandito tayo lahat para maghanap buhay, para bumalik sa ating bayan, na may dala tayong konting napag-ipunan, para to help na sustenta ng mga pamilya natin doon. You cannot be productive if you are hurt or you are injured. Ang pinaka-importante and what we do on a daily basis involves road safety. You cannot go to work, you cannot bring your children to school, you cannot come home if you're not conscious about road safety. Huwag natin papabayaan yan. Mga bata pa kayo, ang pinaka-number one health issues nyo will not be heart attack, will not be stroke, will not be cancer. Ang pinaka-number one cause that could bring you to the hospital is you come to see us in the trauma center. We don't want to see you. And how do you stay away from us? How do we not ever see you? Be very conscious about road safety. Every day you are exposed to risks on the road. Pay attention to it. Be serious about it. And then again, if you have younger colleagues, younger people, be a good role model. Don't be a bad role model. And kahit yung mga hindi iba nating kasama sa trabaho na hindi nating kalahay, or be a good role model for them. Yung mga bagong dating, yung mga kadarating lang yesterday, hindi nila alam how wild or how fast the streets can be, how fast cars. Orient them. Halika, iho, bago ka dito, I will give you an orientation. Kasi these are very, very, very simple things that we have to do on a daily basis, but they will ensure that we continue to makapaghanap buhay tayo, makapag-contribute tayo sa mga pamilya natin back home, and which is what we're all here to do, di ba? Importante yun.
Exactly.
Yeah. Thank you so much, Dr. Consunji, for sharing valuable insights, and I've enjoyed this conversation. Kahit yung dati na-enjoy ko pero parang every time that we get to have Dr. Consunji here, we learn a lot of things, di ba?
Exactly.
And para sa mga listeners and viewers natin, we hope that you found tonight's discussion enlightening and that it inspires you to prioritize yung safety in our everyday lives. So remember lagi na safety is a shared responsibility, and together we can make a significant impact in protecting or preventing accidents, and as well as promoting well-being.
That's correct, partner. So, thank you so much, Doc Consunji. Talagang sasabihin ko to. At first talaga, nung sinabi kong siya yung gusto kong maging guest for the next episode, sabi ko, parang nakaka-intimidate siya. Pero hindi pala. Hindi pala.
Niloloko ko kasi si
niloloko
Annie,
niya ako doon.
Sabi ko, si Doc, from, he has this, all these credentials,
ganyan. Sabi ko, hala.
all these qualifications. Tinatakot ko ng konti. But I know that he's
Pero
a very
hindi
good
naman
guy.
pala.
Yeah.
Of course.
And laging nandyan para mag-share ng
Sabi pa nga
kanyang
niya, this is
expertise
not
sa
gonna be
atin.
It should not be the last. Marami pa tayong pwedeng pag-usapan.
That's right. So, mga kabayan, we hope you've learned and of course enjoyed the insightful discussions with Dr. Consunji. And before we conclude tonight's episode, we would like to take a momentary break. And when we get back, we will discover the celebration of Arab nurses and midwives at yung conference nila. Actually, 2 days yun, kahapon at ngayon, dito sa Qatar. So, we'll be back. Thank you so much, Doc. Thank you.
Thank you. Gamitin niyo yung sticker, ha? Yes, pa.
Usapang Kabayan! Usapang Kabayan! Usapang Kabayan!
94.3 on your frequencies. Number one in your heart. Qabayan Radio 94.3.
The first and the only Filipino radio station in Qatar. Qabayan Radio 94.3.
Amazing offer, exclusive for Qatar Airways Privilege Club members. Earn double Q points when you book Business Elite or Economy Comfort, as well as enjoying additional Avios, increased baggage allowance, ticket flexibility, and preferred seat selection. Make your journeys more rewarding than ever. Book now at QatarAirways.com. Terms and conditions apply. Qatar Airways, going places together.
Mataas na gastusin? No problem yan. Dahil sa Diana Jewelers Best Price, maraming payment options ang mapagpipilian para sa iba't ibang disenyo ng mga alahas tulad ng 18K, 21K, 22K gold, gemstone, maging diamonds. Swak sa budget ang 3 months installment. Free delivery pa. Kaya mga kabayans, bumisita na sa Diana Jewelers Al-Sad Main Branch behind Royal Plaza, Al Nasser Branch o sa Qabayan Souk. Follow Diana Jewelers Facebook and Instagram pages at Diana Jewelers o tumawag sa 55986224. Diana Jewelers, pinagkakatiwalaan ng mga Pinoy.
The current time is 7:39.
Time check is brought to you by Daiso Japan. Most products from 7 Qatari Riyals now open at Tawar Mall ground floor.
For your advertising needs, please contact Qabayan Radio Sales and Marketing Team at 44994943 or email at info@qabayanfm.com. Qabayan Radio 94.3 FM, bringing your business to the Filipino and international communities. We are taking radio to a whole new level. Qabayan Radio 94.3. You are listening to Qabayan Radio 94.3, the first and only Filipino radio station in Qatar.
Amazing offer, exclusive for Qatar Airways Privilege Club members. Earn double Q points when you book Business Elite or Economy Comfort, as well as enjoying additional Avios, increased baggage allowance, ticket flexibility, and preferred seat selection. Make your journeys more rewarding than ever. Book now at QatarAirways.com. Terms and conditions apply. Qatar Airways, going places together.
Craving mouth-watering seafood? Head to Danat Al Bahar Fish Barbecue for the tastiest catch in town. Swing by Old Souk Wakra or Souk Wakif Doha for the freshest seafood, cooked just how you like it. With more than 257,000 unique audience and more than 60,000 followers, Qabayan Radio, Qabayan Radio 94.3 FM is the best. Is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@qabayanfm.com.
Live, online, on air, and on ground. Qabayan Radio 94.3.
We are online for you 24/7. The People's Radio Station, Qabayan Radio 94.3. You are listening to Qabayan Radio 94.3, the first and only Filipino radio station in Qatar.
Qabayan Radio 94.3, loud and proud. Mga kababayan. Qabayan Radio 94.3.
94.3. 94.3. Qabayan Radio. Qabayan Radio. The first and the only Filipino radio station in Qatar.
And all-time favorites.
The music.
Mga kababayan.
The entertainment.
I feel good.
A Filipino touch. Pinoy proud. Qabayan Radio. Qabayan Radio. 94.3. A variety of both original Filipino music, or OPM, and international music. Latest news, hot topics, and many more. 94.3 Qabayan Radio.
Baby, let's go.
The first and the only Filipino radio station in Qatar.
Usapang Qabayan! Usapang Qabayan! Bibigyang linaw ang mga usaping nagbibigay ng interes sa mga kababayan. Sasagutin ang mga katanungan tungkol sa mga isyong may kinalaman sa mga overseas Filipinos. Magbibigay ng mga impormasyon at kaalaman para sa mga mamamayan. Ito ang Usapang Qabayan! Usapang Qabayan! Sabayang mapapakinggan sa radyo at mapapanood live online. Dito lang sa Qabayan Radio 94.3 FM.
Welcome back to Usapang Qabayan, only here at Qabayan Radio 94.3. And right now, partner, we will be playing an exclusive interview video featuring Caroline Agabas, who is a DHP nurse educator of Hamad Medical Corporation and who will be sharing her experience and insights on the celebration of the Arab Day for Nursing and Midwifery in Qatar. This event holds great significance in recognizing the invaluable contributions of nurses and midwives to healthcare in the Arab regions. So mga kabayan, please do watch this video.
Actually, first of all, thank you sa pag-invite sa amin to promote the event. But actually, this is a good opportunity not only for nurses and midwives, but also our colleagues in healthcare from the 22 countries actually of the Arab region to meet, networking. We learn some innovative technologies, strategies, evidence-based practices in nursing and midwifery that we can actually that are also effective in their own countries, and we can also adapt here in Qatar, specifically us. I'm talking about in my perspective as at HMC, as a staff of HMC. But since this is not only an event that will be attended by HMC staff, but also other nursing and midwifery colleagues from Cedar Medicine, we have also from primary healthcare services. So also our colleagues in the Ministry of Public Health. So there are a lot of opportunities to hear from our leaders what are or how they are going to support nurses and midwives as they continue to promote healthcare and deliver the best possible care there is. So apart from learning from other people, it's a way of networking and getting to know our colleagues in the profession as well. The theme for the event is Arab nurses and midwives together as the force for global health and for our future. So basically, we have invited keynote speakers from leadership of nursing and midwifery departments from in and out of the country, our clinical nurse specialists, colleagues, educators, nursing educators, and colleagues from the Ministry of Public Health and those who govern the licensing of nurses across the Arab region. So the discussion will revolve around when it comes to when we have speakers for from our leaders, they will discuss about how they're going to support the nurses and midwives as they deliver competent care. And we also have keynote speaker from our representative, Dr. Rana, to be specific, Dr. Rayana. She is the WHO representative of Qatar. She's going to take a look at the perspective of WHO on the in the future of healthcare in the Arab region. So those are initiatives that or supports or in projects that our leadership has implemented to support our nurses and midwives. In terms of hearing the voices of nurses and midwives, also there are initiatives that allows nurses and midwives to contribute into the decision making process. So we are just not merely following instructions or orders, but we are actively involved in decision making when it comes to our own practices and how we progress in the ladder of our career. So clinical wise naman, we also have mga initiative that are led by nurses, specifically how we maintain that our patients in the hospitals are pressure injury free. How do we maintain that our patients don't get sepsis or they don't acquire infection while they're in the hospital? And what are the trends na ginagamit namin, specifically in our profession, specific sa nursing education, to support our nurses achieve competence? So creating an environment that are close to reality para ma-practice ng mga nurses and ng mga midwives how to really take care of their patients using latest evidence-based technology, evidence-based practice na proven to be effective not only in the country but also globally. So meron silang mga research. There were submissions of abstracts that will talk about this, nurse-led initiatives, and also collaborative with physicians as well. So hindi lang to trabaho ng mga nurses on their own, but also they communicate with physicians kasi nursing is a helping profession. We can't do this alone. We need our colleagues in healthcare. So maganda siyang opportunity para din malaman kung how nurses and physicians also and other members of the healthcare team, yung mga ating mga physiotherapists, occupational therapists, work together to provide the best care for our patients. That is a really good question kasi meron tayong mga speakers. On our, from Qatar itself, from Hamad Medical Corporation, we have our very own Ms. Mariam Almutawa. She is the acting chief nursing officer for corporate nursing and midwifery department. So basically, he's the highest leader of the governing body of nurses and midwives and HNC. So she's going to be talking about the theme, how our leadership supports our nurses and midwives, and then as I mentioned earlier, there is Dr. Rayana, who is the WHO representative of Qatar. So taking a look at how WHO, what is their perspective when it comes to the nurses and midwives in Arab region. So we also have speaker from the Kingdom of Saudi Arabia. So we have Dr. Ahmad Omar Hausawi. So his talk will be about the pioneering global health advancements. So ano yung mga impact ng bagong technology when it comes to healthcare and the delivery of efficient and the most effective nursing care in the Arab region. So apart from that, we have also a speaker from the Kingdom of Bahrain. So this is Dr. Fariba, and how we are going to build resilience for the future. So we just had, and we are still, I think, not I think, but we still have cases of COVID-19. So going through the difficult time and how are we going to use the learnings we got from and during those time and during that time and up to present, how are we going to build a resilient workforce that could actually care for our patients regardless of how difficult the situation may be, because we've learned so much from actually the pandemic, and we are able to see how our nurses and midwives were, able to provide care regardless of the limited resources as well. So those are some of the speakers that we have. They are keynote speakers. So a lot of the abstract that we ask are not only coming from here in Qatar or Doha, but also from other parts of the Arab region. And as I mentioned earlier, these are people who are working together with not only nurses and midwives, but also physicians. And collaboration wise, they work with different healthcare members like the PDs and the OTs and the pharmacists and midwives or midwives colleagues. So kumbaga meron tayong opportunity to share expertise from different perspective, not only to promote good quality healthcare, but also to support nurses and midwives who are delivering this. So merong mga perspective galing sa leadership ng iba't ibang ospital from other countries na makakatulong para siguro mag-adapt tayo ng bagong way and system para makatulong na ma-maintain na yung mga nurses and midwives natin. They remain happy at work, they remain motivated, and in effect, they deliver efficient care. So parang ganun ang magiging impact nito sa mga nurses or midwives or any healthcare professionals na mag-a-attend dito sa event natin. Siguro, one of the things that we really look forward that participants will get out of attending the activity is not only to come out of here inspired and motivated to go back to their clinical areas and put into practice what they've learned, but also to share what they have been using or the technologies they have, the processes they've developed, and the systems they've developed to also help other colleagues in the Arab region. So it's more of like ability when they come out of here, they're able to share what they have so that it can help colleagues in the profession, and also coming out of the 2-day conference and bringing back in their clinical areas new practices and technologies that help support their delivery of care. So yun yung and the motivation that yes, I have a new knowledge, yes, I have a new learning, and I'm really, really excited to apply it in the clinical area because I've seen my colleagues in Doha or from KSA or from the United Arab Emirates do this, and it has been proven successful. So yun yung really aim nung 2-day conference. So I basically that's what we were looking forward na makuha ng ating mga participants when they come out or they completed the 2-day conference. Thank you again sa pag-invite sa amin, but especially for my colleagues in the healthcare at saka kahit hindi naman sa mga kabayan natin na mga Pilipino dito sa Qatar, lalo na yung mga nurses din. I know a lot of our kabayans here in Doha are in the healthcare profession. I invite you to attend mag-attend ng mga events like this because it's not only an opportunity to meet new people or to make connections and networking, but also learning a lot of things that will actually inspire us to promote or to maintain delivering safe care. Because that's the aim in mind. So the goal of our profession is to deliver high quality patient care, maintain good outcomes or patient satisfaction from our patients. So sana yung mga kasamahan ko na nurses, alam ko marami tayo dito ngayon, marami tayo dito sa Doha. Mag-attend tayo ng mga ganitong events because they are opportunities for learning talaga. So I wish na sana when we come out also of these events, kung ano man yung mga initiatives na meron tayo, and a lot of our mga kabayans, very intelligent people, meron silang a lot of mga initiatives na hindi nila na-share, and there's one of the platforms where they could share those projects and initiatives they have para makatulong din sa ating profession. So thank you again, and I hope to see a lot of our colleagues nursing and midwives, especially ating mga kabayang Pilipino na mag-attend ng mga ganitong events. Kita-kita tayo dun.
And there you go, mga kabayan. We are truly grateful to Caroline Gabas for sharing her thoughts and experiences with us. And it's it's definitely through the dedication and passionate individuals like her, no, that the nursing profession continues to thrive and make a positive impact on patient care.
Tama yan, RJ Andy. And our nurses, pati na rin yung mga midwives natin, are the backbone of healthcare, providing compassionate care and support sa lahat ng mga patients and their families. And a big thank you to all of our healthcare professionals out there.
That's right. And andito pa si Doc Rafael Consuni kasi hindi po namin siya pinaalis kasi for sure, may gusto kang batiin po, Doc.
Akala ko kasi ang dami mong tanong kaya hindi pinaalis.
Yung supportive brother mo or your family sa Philippines.
Babatiin ko lang yung kapatid ko. Sabi niya, naantok na ako. But my brother is a board member of the Automobile Association of the Philippines, so we share this advocacy for road safety.
Wow.
I hope that he listened, and I hope that we can share more experiences and more recommendations for road safety, not only in Qatar, but in the Philippines. But again, for all Filipinos, sa lahat ng mga kabayan here, and wherever you're listening, don't forget that road safety is everybody's responsibility. It begins the moment you get out of your house and you get into your car, and it should be always something that we think about whatever we do when we're exposed to the road. And being a role model is something that cannot be underemphasized. You have to be a good role model for your colleagues, for your younger relatives, and more so for your own family. So be a good role model, get home safely, mag-ipon ka, makapagsuporta tayo ng pamilya natin sa Pilipinas. This is our goal. We cannot do it if we're injured or if we get into a crash. So please take road safety very, very seriously. Thank you.
Ayun. Thank you so much, Doc Kunsunhi, for gracing this interview. And of course, looking forward for more of this insightful episode and topic with Dr. Kunsunhi.
Yes, and thank you once again, Dr. Konsunhi. And a big thank you as well to all our listeners and viewers for tuning in to Qabayan Radio for Usapang Qabayan ngayong gabi na ito. And remember, stay informed, stay vigilant, and prioritize safety in all aspects of your lives. This is RJ Kenzo.
And this is RJ Andy signing off for tonight's Usapang Qabayan episode.
Stay safe, keep smiling, and be blessed.
Usapang Kabayan! Usapang Kabayan! Bibigyang linaw ang mga usaping nagbibigay ng interes sa mga kababayan. Sasagutin ang mga katanungan tungkol sa mga isyong may kinalaman sa mga overseas Filipinos. Magbibigay ng mga impormasyon at kaalaman para sa mga mamamayan. Ito ang Usapang Kabayan! Usapang Kabayan! Sabayang mapapakinggan sa radyo at mapapanood live online. Dito lang sa Qabayan Radio 94.3 FM. You're listening to Qabayan Radio 94.3, the first and only Filipino radio station in Qatar.
Live, online, on air, and on ground. Qabayan Radio 94.3.
Amazing offer, exclusive for Qatar Airways Privilege Club members. Earn double Q points when you book Business Elite or Economy Comfort, as well as enjoying additional Avios, increased baggage allowance, ticket flexibility, and preferred seat selection. Make your journey